Awesome. All right, well, thank you everyone for joining. I'm Andrea Fumafredo, and I'm the Director of Programs at the AKC Canine Health Foundation, and we're very happy to be working with the YTCAF and Dr. Simpson this evening, as well as with their research. A quick introduction here for Dr. Simpson. Dr. Simpson graduated from Edinburgh in 1984 and gained a PhD in gastroenterology at the University of Leicester in 1988. After an internship at the University of Pennsylvania and a medicine residency at The Ohio State University, he was a lecturer at the other Royal Veterinary College. He joined the faculty at Cornell University in 1995. He's a diplomat of the American and European Colleges of Veterinary Internal Medicine and a member of the section of Small Animal Internal Medicine at Cornell. He's also a recipient of the National Phi Zeta and Pfizer Awards for Research, the AVMF AKC Career Achievement Award in Canine Research, and the Bourgelat Award for Outstanding Contributions to the Field of Small Animal Practice, as well as a past president of the Comparative Gastroenterology Society. His research interests are centered below the diaphragm with a focus on inflammatory diseases of the GI tract, including the pancreas and the liver, host bacterial interactions in health and disease, and culture-independent bacteriology. So I'll hand it over to Dr. Simpson, who we're so happy to have here.
Thank you very much, Andrea. It's nice to be here, and thanks to everyone for making this possible. Tonight we're going to focus on a disease called protein-losing enteropathy. And protein-losing enteropathy is a disease of the intestines where the intestines are kind of leaky and they leak proteins from the blood into the intestinal tract. And so the blood proteins decrease while the animal has signs of typically diarrhea or weight loss. So protein-losing enteropathy, intestinal protein loss, typically associated with signs of gastrointestinal disease. So if we start with what it looks like, one of the more common breeds that this disease can affect are Yorkshire Terriers. It's not the only breed, and we'll come to that later, but one of the most common presenting complaints is weight loss. And this is a 7-year-old male neutered Yorkie with weight loss, and the owner's concerned because they've been losing weight, and also because their tummy, their abdomen seems kind of distended. There's been some occasional diarrhea, but it's not been a consistent feature. So the stool is a little bit loose, but it kind of comes and goes, and there's not any obvious blood or mucus in it, and it just seems a little bit loose. And so they've taken it, their dog to their local veterinarian, and they've said, well, let's try altering the diet, let's kind of deworm them, take care of the common things that might cause diarrhea. And there's been no real response. And so the physical exam, when you examine, you can see this little Yorkie. He's even thinner than many Yorkies are. He's got poor body condition, and his abdomen feels kind of distended with fluid. And so I don't know how many of you have had Yorkies who have had weight loss, and then their abdomen or their tummy seem to swell with fluid. There's different causes of that, and your vet, when they examine them, would say, well, you know, what's a common thing in Yorkies that might cause distended abdomen and fluid there? And one of the things would be a heart murmur. So if there's congestive heart failure, but this dog doesn't have an obvious heart murmur, and so there's nothing obvious going on there. They're not yellow. They don't seem to have end-stage liver disease. They're 7 years old. They're a bit old for a congenital shunt that would have caused liver dysfunction, causing fluid in the abdomen if it was a disease they were born with. And could it be an acquired liver disease? Maybe, but again, they're not yellow, and other things that might go with that. And so your vet is scratching their head, and you're scratching your head saying, well, it might not be heart disease because there's no murmur, there's no obvious other signs of things that would cause the abdomen to be distended, like big organs, and there is diarrhea. So how are we going to work this out? How are we going to work out what's going to happen here and what's going on. Well, one of the things that we do is we'll say, well, we're not quite sure of the body processes going on, so let's have a look at the blood work to see what's happening. So what are the circulating cells doing, and what's the chemistry doing in the blood work that would give us a clue as to what the organs are that might be involved in this animal's signs. So abdominal distension, some weight loss. And this Yorkie is mildly anemic, so the red blood cell count is slightly low, but in and of itself, it's only slightly low and doesn't really, wouldn't really account for the degree of lethargy or weight loss. White cell count and all the other stuff looks pretty good. And you run down the white cell count and you come to the platelet number, and the platelets are things that help to cause the blood to clot and stop bleeding and things. And they seem kind of high, and the total protein is low. Normally this is 5.5 to 7.5. So high platelets and low protein. So what might be the causes of that, or what's going on? Well, if we look at the blood chemistry, we can see that the albumin is low and the globulin is low. And these are two of the blood proteins. And albumin and globulin both being low, and the total protein being low. And then we look down at this value. This is cholesterol. When we see this pattern of changes, this tends to point to intestinal disease. So a low albumin, a low globulin, a low cholesterol tends to point towards the gut as a source of loss. And there's no indication of these are liver enzymes. There's no real indication of liver disease, and there's no increase in liver enzymes or the yellow pigment that builds up. There's no heart murmur or anything else. And so your vet would be going, okay, well, it looks as though the protein is low, the dog has diarrhea, the fluid in the abdomen may well be due to the low protein, and that's why it's building up. So maybe this dog could have a protein losing enteropathy. And one of the things we see with that disease, and quite frequently, are high platelets. And so when we look at the serum biochemistry, the low albumin, the low cholesterol point towards this group of conditions called protein losing enteropathies. And enteropathy just means intestinal disease. So protein losing intestinal diseases. And the ones that cause chronic protein loss are inflammatory bowel disease, which is a disease where it's thought to be immune mediated or underlying genetic basis and other things that interact, and they cause the gut to become really inflamed, and it will cause signs of disease. It will interfere with absorption. Sometimes we'll have cancers of the intestine. The most common one is lymphoma as a diffuse disease, or we have disorders of little vessels called lymphatics that drain fluid from the intestine, and it's called lymphangiectasia. So the three most common causes of chronic protein losing and gastrointestinal disease or intestinal disease are inflammatory bowel disease and cancer of some form or dilated lymphatics. Now there's other things that can be there, and we have to rule these out, but these are the most common ones. Now when we see a low albumin and protein loss in a dog with signs of gastrointestinal disease and diarrhea, it means it's more severe than a dog who doesn't have low proteins. And so there's several studies and multiple clinical observations being done that show if you have diarrhea and you have protein loss and it's due to intestinal disease, it's a much more severe disease. In fact, you're 10 to 11 times more likely to not respond to treatment if you have low proteins. So this highlights these dogs and this patient for further investigation, because if you don't know what's causing it, how do you treat it? And even when you do know how to treat it or think you know how to treat it, the chances of a poor outcome are much worse than a dog with a normal serum protein level. So how do we know it's really the gut? How do we make sure? How can we focus in on things? How can we rule out structural diseases and other things that might happen in the gut? Well, if we look up here, if we took an x-ray of this dog or a radiograph, if there's fluid in the abdomen, and typically you can bang on the abdomen and you feel like a fluid wave. If you took an x-ray, it looks very white and it's not very helpful because it covers all the detail. And so the test of choice that we typically use in animals with diarrhea and a low albumin and fluid there is we'll use ultrasound. And the ultrasound likes fluid, and this is the fluid appears black here, and this is an ultrasound from an animal with liver disease. In this dog, we wouldn't expect to see any venous congestion in the liver. We'd see the black fluid, and then we'd look at the gut to say, do you have any focal lesions or thickenings, and what's going on here? Do you have something that would be obviously responsible for it? And one of the changes we look for in dogs with protein loss, if they don't have masses, they don't have evidence of cardiac disease or liver disease or other things, or do they have this change in the intestines called hyperechoic striations? So that means the sound waves bounce off the gut and you see these white stripes and speckles in the intestine. So these are the white stripes or speckles in the intestine. And what we see in this Yorkie is he's got fluid in the abdomen. That's all this black stuff. He has hyperechoic speckles and linear striations. And this is technical terms, but basically it makes us confident that the intestine looks abnormal. There's fluid in the abdomen. The fluid in the abdomen is very pale and not dark or high in protein. So it looks as though it's caused by low blood proteins letting the fluid leak out. This is a dog that probably has a protein losing enteropathy, or its gut is the home of the protein loss. So you're looking at your little Yorkie now and you're saying, okay, well, how sure can I be that the cause of the low protein is the intestinal disease? How can I be sure I'm going the right direction? And are there other causes? You know, what are the causes here? And so we go back to the list and we'd say, well, could he have some sort of inflammatory bowel disease? Could he have lymphangiectasia? Or could there be some sort of cancer if there's not a focal mass? And these diseases often require different treatments. And so ideally, we often want to actually grab a small piece of the intestine or the affected parts to say, okay, this is really what's going on here. There's big dilated lymphatics, or there's inflammation, and the inflammation has lots of plasma cells or lymphocytes, which are immune cells. Maybe we need to use steroids, or unfortunately, it looks as though there's lots of lymphocytes, but they're invading the epithelium, and it could be cancer, and we'd use a different treatment there, something like chlorambucil or other treatments. So ideally, your dog, to be definitive, or this dog would need a biopsy. But if we know it's a Yorkshire Terrier and he's got protein losing enteropathy and striations, if you play the odds, the chances are they may have a disease called protein losing enteropathy of the Yorkshire Terrier, which is a mix of disorders. But again, to be sure, an intestinal biopsy is what we need to optimize treatment. So how do you get the biopsies? Well, in the old days, we used to do a lot more surgery to explore the intestines. But with a combination now of all the blood work and ultrasound, we can kind of image the gut and rule out many of the focal diseases. And we're left with certain patterns that would say, okay, this dog has linear striations, there's no focal masses and fluid, and we can see this throughout the gut. So maybe we should do an endoscopy rather than using surgery to open the animal's abdomen. And with endoscopy, we can steer an endoscope, a long flexible tube, into the intestines and take small pieces. And we can also look at the guts as well. And one of the characteristics things that we see with protein-losing enteropathy, if there's lymphatic dilatation, is we see these white blebs. If you can look at this picture here, this is the inside of the intestine, and you can see these little white speckles in the intestine. These are actually dilated lymphatics. And so we know, just looking at the gut, that there's some evidence for dilated lymphatics, but there may also be concurrent inflammation. If we'd seen focal changes in the intestine, or focal masses, or big lymph nodes, or other things, we may well have taken the animal to surgery to get full thickness biopsies. But if it's diffuse and we think we can have a look with an endoscope, then that's the least invasive procedure for the dog. And what we see in this dog, so we do endoscopy, we anesthetize this Yorkie, we drive the endoscope down through the stomach and into the small intestine. And this is the duodenum, and we go, oh my goodness, this looks abnormal. And you can see there's all these blebs within the small intestine. And these are characteristic of dilated lymphatics, and these are the vessels that drain fluid from the intestine. So the gastroenterologist or endoscopist who's doing this would say, gosh, this looks abnormal, this looks consistent with lymphangiectasia, but lymphangiectasia can be part of many other diseases, so we're always going to take biopsies and then we'll see what comes back. And when we look at the histopathology, so we take the biopsies with small forceps and we embed them and send them to a pathologist, and they can look at the intestinal structure. And if you remember, the intestine, the lining, it's almost like many, many fingers. Like if we look on this slide here, there's many finger-like projections in the intestine that help to maximize the ability to absorb food. And there's normally lots and lots of regular fingers. So it's like having millions and millions of gloved hands kind of poking into the intestine. And you can see in this Yorkshire Terrier, he's got some fingers that kind of stick up, but these guys are blunted. There's lots of cells here. And there's these dilated structures within the fingers. These are lymphatics. So this is a relatively, compared to this one, a normal villus. This is the thing that projects into the intestine. This one's stunted and blunted and cellular. And if you look at the whole gut as a whole, you can see there's stunted, blunted villi here. And then there's all this stuff at the base underneath the villi, all this pink stuff. And these large pink spheres underneath where the villi should be projecting up. And this is all protein that has leaked out from the intestines into the crypts at the base of the intestine. So it's come from the body into the intestines. And these are not filled with bacteria. They're sometimes called crypt abscesses, and they're actually more appropriately called crypt cysts. They're accumulations of fluid at the base of the intestines. And Yorkshire Terriers and other breeds that have protein-losing enteropathy, this is often what you see. In Yorkies, you see an awful lot of them, though. You see these pink things here that are filled with this fluid that is protein they're losing. And so when the pathologist looks at this, and the pathologist then talks to the vet who's managing your case, and the vet then talks to you, and they say, okay, what do we have here? Well, we seem to have dilated lymphatics, and we've got inflammation in the gut. And the cells that are there seem to be lymphocytes and plasma cells and immune cells. There's also stunting and blunting of the villi. So there's inflammation of the gut, there's dilated lymphatics, and there's this big evidence of protein loss, these things called crypt cysts that are pink. And so weighing this up, you're going, okay, lymphangiectasia, inflammation, crypt cysts. What does this mean? How do I treat it? Does this mean that it's a bacterial disease that's driving inflammation and I really have to put it on massive antibiotics? That wouldn't be the response here. You'd expect to see different types of inflammation. unless the animal was sick and the bacteria were coming across. So I wouldn't reach for a super big gun antibiotic. When we see lymphangiectasia and cryptcysts, but we also have inflammation, would you want to immunosuppress to get rid of the inflammation? Well, you might start gently, because some of these animals don't like being immunosuppressed because they're leaking all sorts of things from their guts across into their body. And if you suppress the immune system, they can't respond to bacteria and other things. So this is a disease, and this is a group of findings that would make me be careful. I wouldn't leap in one set direction and be very, very aggressive. And that's based on the histopathology and our knowledge of how these dogs with this types of condition respond. So lymphangiectasia, or dilated lymphatics, let's review some of the things that may be causing the intestinal inflammation, what it looks like. So lymphangiectasia are dilations of the lymphatics. It means it's a fluid-filled, distended lymphatic. It's not draining like it should do, and it drains lymph. If we look at this picture here, this is an animal with primary lymphangiectasia, and you can see the villi don't look that bad. You've got these fingers that are sticking up from the base of the intestine, but you can't really see much in here in the way of cells because it's all filled with lymph. This is kind of a primary lymphangiectasia, and that's not what this Yorkshire Terrier has. And this is a different sort of disease. We see other breeds with dilated lymphatics and protein-losing enteropathies. One of the more common ones that we see with severe disease is a soft-coated Wheaten Terrier, and they can lose protein into their intestines, and they also lose it into their kidneys. Another breed that can have very, very severe intestinal protein loss, Norwegian Lundehund, and they have often have lymphangiectasia as a dominant feature. But some dilatation or some distensional lymphatics can be part of many severe intestinal diseases. And so we can see Rottweilers, Dachshunds, other patients and other breeds with protein-losing gastrointestinal diseases who have some degree of lymphatic distension and protein loss from the lymphatics. But the poster child of all the lymphatics and the lymphangiectasias, and the most common one that we see, is our friend the Yorkshire Terrier. If you look at dilated lymphatics and severe intestinal disease, studies range from 4 to 10 times more likely than other breeds is the Yorkshire Terrier. But many other breeds, so just to summarize, many other breeds can have some degree of lymphatic dilation. Others seem to have more of it than some of the other breeds. And the king of them all at the minute seems to be the Yorkshire Terrier in terms of having dilated lymphatics and protein loss into their gut. So how do we treat this disease? Well, you can modify the diet. You can restrict fat because lymphatics are involved in fat absorption. There's also immune cells there, and these immune cells may be reacting to different constituents of the diet. So we can modify the diet so it may not be as inflammatory. And one way we may do that is to feed them proteins that have been smashed up so the immune system doesn't recognize them, a so-called hydrolyzed diet. So fat restriction or feeding a high quality or hydrolyzed diet. Fat's not absorbed well in these dogs with protein-losing enteropathy. So how do we get calories? How do we get energy into them? The weight loss is due to loss of calories. Well, we can feed them certain oils that are better absorbed and are high in calories, and those are called medium-chain triglycerides. We can use drugs that try and decrease the inflammation, and these range from steroids, such as prednisolone, to other immunoactive drugs, such as cyclosporin or Imuran, that are aimed at decreasing inflammation and the cells coming in. And if the dog is really has a very distended abdomen and we want to get rid of some of the fluid, we may use diuretics to get rid of some of the fluid. Now, if you recall, this dog had a very high platelet count, and many people used to overlook the platelet counts, and you go, okay, it's got a high platelet count, it might be iron deficient. But the more we know now about the clotting system, if you have a high platelet count and you're very inflamed, the more likely you are, if you're a dog or a person, to throw clots and for those clots to cause problems. And so we often put these dogs on aspirin to make their platelets less sticky and stop their blood from clotting. We also know that if the gut's leaky one way, it tends to be leaky the other way. So if you're leaking protein and you're inflamed, you can also leak things the other way, and those things that you leak are often bacteria. So we may often use antibiotics to stop this seeding of bacteria as it goes back from the gut into the bloodstream. So in general, these are some of the food groups that we might use in dogs in general with lymphatics or inflammatory bowel disease. So if we just back up a little bit, remember I said if you're losing protein and you've got inflammation in your gut, you're much more likely to have a bad outcome. And we know that from lots of experience and trials now, that if you're a dog almost of any breed and you have a normal serum protein and you have normal imaging and normal cholesterol and other things, the chances are you may respond to something like diet modification or antibiotics such as Tylosin, and your clinical signs will go away. But if you have a low protein and you have changes in your gut, like fusion or atrophy of the villi, so the little fingers become fused or they shrivel up, and you're losing protein into your gut, you've got a much more severe disease, and the outcome is much less predictable. In fact, 50% of dogs in general who have protein-losing gut disease will do poorly, and some of them will die or will be euthanized because they have severe disease. Whereas the ones with normal protein, 80 to 90% of those dogs will do fine. And so low protein and gut disease is not a good thing to have if you're playing percentages. It doesn't mean that we can't fix it. It just means we've got less chance of fixing it successfully. So for anyone with other breeds and things, that you remember the other breeds, and we'll talk about genetics later, there's lots of breeds that can have protein loss as part of their gut disease, but the Yorkies are one of the most severe. And this patient that we're talking about is a Yorkshire Terrier. And they have kind of, within different breeds, there's certain variants or certain types of inflammation that we tend to see more frequently. And in fact, the person who looks at the histology or the biopsies of the gut could say, oh, this looks like such and such. But the outcome often depends on what the breed is and what the overall picture is, rather than just the histology, because often there's a common endpoint there that's a result of many different things going on. So we're going to focus on Yorkies just now. And the Yorkshire Terrier protein-losing gut disease, we tend to see weight loss. We may see diarrhea. We may see high platelets, low proteins in the blood, low cholesterol. And the other thing that we'll see in these dogs is often when you look at their biochemistry results, you'll see they may have low calcium or magnesium. These are two minerals in the blood. And often we relate those to just having a low albumin. But what's actually worked out in some of the dogs with severe protein loss, and particularly Yorkies, is that Yorkies and animals with severe protein loss, they don't absorb fat-soluble vitamins. And so they're not absorbing vitamins that help them to regulate some of the other components in their blood. And so low calcium is a result of vitamin D deficiency. Bleeding tendencies may be because they're malabsorbing vitamin K. And so vitamin K and vitamin D are two of the vitamins or vitamins that they're fat soluble vitamins, and these dogs don't absorb fat well, and they're very deficient. And there are reports of Yorkies coming in twitching and seizuring because they have very low vitamin Ds and magnesiums, and we may need to give these into the bloodstream to stop the twitching and seizuring because they're very low secondary to the intestinal disease. So if you have a Yorkie, how do you know if it has protein-losing enteropathy? I don't know about you, but often when someone tells you about a disease, you may run home and think, gosh, do I have this disease, or does my animal have this disease? So most animals with significant disease will have clinical signs. And so the clinical signs that are most common in Yorkies are weight loss, a distended abdomen, and some degree of diarrhea. And then when your vet takes blood, the albumin or the protein levels and the cholesterol are low. And then if they work it up further and they say, let's rule out liver, let's rule out heart and other things as a cause of the big abdomen. If it looks as though the gut has hyperechoic striations, or there's not heart disease or liver disease, the chances of having gut as a source are more likely. And then, as we said, to definitively prove it, you may well have to get a biopsy and help to distinguish other diseases. But the first and foremost things are typically weight loss, diarrhea, abdominal distension, and low blood proteins. And then we can take it from there to try and work out. Now, some Yorkies are tiny. Some of them are very small, or they may be very sick. And if they're too sick to undergo an intestinal biopsy, and we have all of the other evidence, the blood work, the ultrasound, the breed, and ruling out other diseases, then we may treat without a biopsy. But you always risk not treating the right disease if you don't have many things that point towards that disease. How serious is the protein loss in Yorkies and other breeds? Well, if you recall, having low proteins and intestinal disease means that your intestinal disease is more severe than if you had normal proteins. And in Yorkies, it's actually often more severe than some of the other breeds as well. So if we look at the outcome, there are studies, and this will be in the handouts that you can access from the website. And in fact, this whole presentation you can download from the website and have a look at and read it in your own time. And then we'll answer any questions at the end if there's any questions. Some dogs will respond to just restricting fat. And I remember when I first started to see Yorkies with this disease, I was a resident at Ohio State University long time ago. And we used to feed them low-fat cottage cheese and rice. And some of these dogs would do quite well. And there are now more controlled studies showing that when there's lymphatic dilatation, simply feeding a low-fat diet may be an effective treatment if you combine it with something like prednisolone, or even if you don't, as a simple anti-inflammatory. So low-dose steroids and diet may have an effect. And here's a study from Ohio State in 2017 that these animals had presumptive protein loss. They weren't on immunosuppressives, but they found that many of these Yorkies, or in fact 11 of the cases, many of them responded to just changing their diet to restrict fat. So often in Yorkshire Terriers, we might start with a fat-restricted diet to see if it makes any difference at all. So we're not giving them potent drugs or immunosuppressing them. We're saying, let's start with a fat-restricted diet and see if your signs go away. However, in our institution at Cornell, this is 14 dogs that we looked at, or 14 Yorkies that we looked at prospectively. So we followed them all for the outcome and followed everything that they did. And their median age was 96 months. Some of them had vomiting and diarrhea. They didn't like their food, so they're more severely ill than the mild ones. They had fluid in their chest and their abdomen, and their blood proteins were low. And when we biopsied these dogs, this is when we discovered that many of these dogs actually have these big crypt cysts rather than just lymphangiectasia and inflammation. And when we treated them as usual with diet, with steroids, we gave them Imuran or antibiotics. 7 of 12 of these dogs were actually dead or euthanized within 3 months of diagnosis. So this is a severe cluster of Yorkshire Terriers, and maybe that's because we're a tertiary referral center. These are the ones that have failed therapy in practice, but they were more severe than the Yorkies I'd typically been used to seeing in the past. But they're pretty much the norm for the ones that come to our referral hospitals now. And this is what we were seeing, and we can this is pictures of the dogs that came to our clinic. It's a much more severe and fulminant type of inflammation than had been described previously. University of Minnesota looked at a bunch of dogs as well, and what they found is that in 30 of the dogs that they followed, they had more females than males. They often had diarrhea, the fluid in the abdomen in about half the dogs, and weight loss. And their histology was dilated lymphatics, crypt lesions, villus stunting, similar to ours. All of the dogs had got steroids, so they'd been started on diet, but they were required to go and with steroids. And they followed up 23 of them, and half of the dogs failed to respond to treatment. And so median survival of the ones that responded was 44 months, so about almost 4 years, and the non-responders was 12 months. And some of the dogs die suddenly, and that's what we'd seen as well, is that some of these Yorkshire Terriers die very suddenly. And the ones that die very suddenly, in our experience, tend to be throwing clots, blood clots, to different organs, and we think it's due to their high platelets and lots of inflammation and other things. And some of them also have other signs related to their calcium or other vitamin levels. So what does this mean? It means that protein-losing enteropathy in Yorkies and other breeds, but particularly Yorkies, is unpredictable. It can be very serious, and it's often fatal. You know, we can range from some respond to diet, but if they don't respond to diet, more than 50% of those dogs are likely to die in a relatively short space of time, within 3 months to a year, and some of them may die suddenly. And so this is not a good disease. This is not a good thing. We obviously want to get rid of this. If we can't treat it, how can we get rid of it? And so the question will be, if there's no effective treatment, we can't give them a magic bullet and say, gosh, we've cured you, or we put you into remission. How do we stop the disease from developing? So if we back up at the minute and we look at some different breeds of dogs that get severe intestinal diseases. So for example, if we have Irish setters, they have a disease called gluten-sensitive enteropathy that was almost like celiac disease in people, and it's not that common, and it's more easily managed than the disease in Yorkies. German Shepherd dogs have a very severe, or can have very severe disease that may respond to antibiotics or may not, or may not respond, and they have a breed-specific intestinal disease. Basenjis have an immunoproliferative small intestinal disease that may progress to cancer in the gut. The poor Norwegian Lundehund, if they have intestinal disease and they've got low protein, it tends to be protein-losing enteropathy of the Lundehund, and they may also have severe changes in their stomachs that may lead to cancer. The soft-coated Wheaten Terrier gets a double hit on the kidneys and the gut. And luckily, many of the soft-coated Wheatens with intestinal disease, they often respond very well to diet, but it's still a severe disease. Then Shar-Peis, they often have a vitamin B12 deficiency, and severe intestinal disease. And I could add to this breeds that are emerging with protein-losing enteropathy, Rottweilers, Dachshunds, and some of the small terrier breeds seem to be becoming more common in terms of their protein-losing enteropathies. So rather than treating some of these diseases or hoping that we'll get treatments that will make them better or take them into remission, how do we address disease that's more common in a breed than other breeds? And how do we actually stop the disease from happening in the first place? Why don't we look at the beginning rather than the end and hope we can fix it when we might not be able to? Why don't we just stop it from happening? And so how can we get rid of it? One of the key things that we could do is maybe we don't want to breed from affected dogs. So one of the mainstays of my research in my lab is we've been looking at Yorkies and German Shepherds. We've also been looking at French Bulldogs and Boxers, and they have a very severe form of colonic disease caused by invasive bacteria, and they're genetically susceptible. And so trying to find the genetics of these diseases will help us to try and eradicate them. So we can test to see if the animal is at risk for the disease and then not breeding from it. So how do we identify it early when it doesn't have clinical signs? We have to have another means of identifying it. And one of those means is to say, oh gosh, you carry the genes that are associated with this disease. Let's not choose you for breeding. Let's choose someone else rather than you for this for breeding. Dogs, and this is where you can help for almost any breed-related disease. If you have a dog that has a certain disease or doesn't have a certain disease, then you can help to eradicate those diseases using genetic testing. And so for Yorkies, through the Breed Society, the Yorkie Breed Health Society, and the American Kennel Club, we have a study that's aimed at looking at the genetic basis of protein-losing enteropathy. And this is a fancy name for basically, we want to find out why dogs, what are the genes that are related to this disease. And once we know those genes, we can test animals to see if they have those genes. And we don't do anything else other than that, apart from saying, if you want to eradicate this disease, probably you're better not to breed from this dog and maybe breed from another dog that doesn't have this disease. Now, obviously, the other dog may have other traits that you do or don't want, but it's kind of a percentages game. Let's get rid of the nasty diseases first and see what we're left with, because that's where we want to go. We want to have healthy animals and dogs in the end. So how can you actually help with this study, and what can you do for any genetic study or any study to eradicate diseases from a breed? So in this study, the animals that are eligible, the Yorkies who are eligible, are ones who have a diagnosis of protein-losing enteropathy. And ideally, those are going to be dogs who have a low albumin and clinical signs, and they've had a thorough workup that ideally would include a biopsy of the intestine to say, to be sure, this is intestinal disease that's causing the low protein, and we have a blood sample from you. However, we'd also be open to accepting blood samples from dogs who they say, well, we've ruled out liver disease, we've ruled out heart disease, the gut looks abnormal in ultrasound, and the dog has diarrhea, but we really couldn't go to a biopsy because the dog was too sick or not doing well enough. And those would be other samples we'd be interested in having. Now, who would we use as a control? Well, this is a disease that tends to happen in middle age. It's not one of these early onset diseases where they're born with the fulminant disease. It tends to develop when they're older. Now, that makes it harder to eradicate because you have carriers who don't show signs until they're older. And so ideally, well, who we want as our test population are Yorkies who are greater than 10 years of age, who don't have chronic intestinal disease and have a normal serum albumin. Now, they could have heart disease, they could have liver disease, they could have ingrowing toenails, they could have poor hair coats, they could have all sorts of other things, as long as they don't have protein-losing enteropathy. Some of the ideal ones might be our happy, healthy Yorkies who don't have anything, but Yorkies with other diseases apart from protein-losing enteropathy become a really good control group. And all that we need for this is we need our reports of the animals, and I'll show you the forms in a minute, to show that they really have the disease or don't have the disease, and a blood sample. And the blood sample we can test proteins on, and we can also do genetic analysis on to try and find where the genes are that actually are linked to this disease. And then with that knowledge, we can try and develop a test and advise you on saying, well, okay, this seems to be linked here, or this one's protective, this one's a risk factor about breeding. As with all studies, you have to consent to give blood and then to enroll your dog in the study. And this is approved by the animal use and care committees. All we're taking is a blood sample. The animal's identity is anonymous. We will never disclose animals' identities. No one knows where the genes came from in the analysis. None of those things will be printed or published in the analysis. So every sample is anonymous, and the description of the patient is used what's to make the decision. The blood sample is taken by your vet and then mailed to our lab at Cornell, and then we extract DNA, and then we will archive it, and then we'll run all the genome-wide chips when we have enough samples for each batch. We have a special medical history form that will be on the website that you can download and fill in, and it asks you about how your dog's doing, what its clinical signs are, how it was diagnosed, to give us the information we need to know to say, are you an affected dog? Are you a control dog? If you're an affected dog, ideally we'd love to see a biopsy and clinical workup. We don't have to see definitive biopsy, but we would like to see that if we can, to be sure, to be sure, and to be sure. So we really need your help. We want to recruit over 200 samples over 2 years. We want as many affected and unaffected dogs. I would love it if we had 400 dogs, and hopefully you as breeders and owners and friends of friends who have old Yorkies, who are happy, healthy Yorkies, who are lying on the blanket in front of the fire, who don't have any GI disease. Gosh, there must be at least 100 to 200 of those dogs out there now. We'd love blood samples from those guys, because they're just as useful as the blood samples from the ones who do have the diarrhea, the weight loss, or the abdominal distension. But realistically, we want as many samples as we can, and then hopefully we can start to identify these genes and develop a test. And working together, we can hopefully eradicate protein-losing enteropathy, because if you look at the dogs who are severely affected, over 50% of those dogs are dead within a year of diagnosis, and none of us really want that to happen. So I'm going to stop here, and I'd like to thank the AKC and the Yorkie Health Foundation and all of you who have listened, and I'm happy to take questions and move on from here.